Hello, Bacho. Dr. Omkar Sonone here, Faculty of Surgery at AFMG. And today we have with us Dr. Talib Bilal, Faculty of Obs-Gynae at AFMG. Both of us are today recording this video just for you because we know a lot of students who are appearing for the upcoming FMG examination on 26th of July 2025 are in a dilemma because all of you have completed your first reading and now you are not able to understand that how to approach your revisions. Even if you have made your plans for revisions, you are not able to follow them properly and you're not sure that will these revision plans be executed and ultimately will they be efficient or not. So don't worry, we are there to help you all. So let's begin with the strategy for the upcoming FMG July 2025. We will be talking about what to do and what not to do basically in the revision strategy for the upcoming FMG examination. So let's begin. The first thing I would like all of you to keep in mind basically is you're so close to the victory. Don't dare to give up now, because I know definitely what is going to happen. There will be two sets of students, Vijay. The first set of students will be who have been working hard really for the last 3 to 4 months, Vita, and now they are going to lose the hope somewhere, or they will get off track, or they tend to get derailed. So the most important thing, as I always say, that this FMG preparation is basically a marathon journey. And in marathon, we know that we have to sprint in the last lap. We do not have to pace down, rather we have to pace up. So this is your time to pace up now. So do not dare basically to pace down or do not dare to get off track, bache. You have been working really hard for the last 3 to 4 months. Please keep up the pace. That is what I would recommend you, because I've seen a lot of people getting off track and getting hopeless towards the last span. Do not do that. Next important, the second group of students or the second set of students would be the ones definitely who may not have worked hard in the initial 3 to 4 months. But bache, this is your time now to put in all that you have. Okay, give your 100% efforts in these last 2 months, and then I've seen people changing their destiny basically. Okay, you might not have thought that the results will turn in your favor, but I've seen students putting up a lot of effort in the last 2 months and then turning the results all around. Okay, so make sure that both these sets of students are really working hard. Okay, and that would begin by planning up a proper strategy, because I always say that it's not only important to work hard basically, but it is equally important to have a strategic plan and an approach towards the preparation. So if you want to plan effective revisions, please have a plan and a strategy with you. So let's begin with that, because we have not been only mentoring, but we have experienced the journey ourselves. So we know it much, much better basically, because we have been through the journey. So we know what's possible and what's not possible practically and in reality. Okay, so let's talk about that. First of all, we have to talk about the strategy. So a few points I'll throw some light upon. And the first one will be, in this upcoming 60 days, we are going to talk about the strategy for 2 months or 60 days, which in these upcoming 60 days, I would like you basically to plan out 2 effective and comprehensive revisions. Now, you might have heard a lot of people saying, no, we have to do 3 revisions and 4 revisions. That's not practically possible always and for each and every one, beta. So what is practically possible for each and every student is to minimum plan out 2 effective and comprehensive revisions. Now, in that, the first revision which is there, which it should be a proper and a thorough revision, which should take at least 35 to 36 days, beta. And the second can be a shorter or a rapid revision basically, which can take around 23 to 24 days. Okay, if you definitely plan out these 2 proper revisions, you will remember majority of the things. Because now at this point of time, what is your problem? That you may have read a lot of things, but you're not able to remember them. You're not able to recall them while you solve the MCQs, right? And that's because just lack of revisions, beta. So what you have to work on is basically appearing for more number of revisions. If you're having more time basically, so you can easily plan out a third revision also for the subjects you find more difficult. Do not plan out third revision for the easier subjects. Otherwise, what will happen? You will keep on brushing up your easier subjects over and over again, and your weaker subjects will keep on getting weaker and weaker day by day. And then definitely that will give you a lot of FOMO, and that will give you immense amount of anxiety before the examination. So do not do that. Each and every subject is going to be important. So plan out revisions for each and every subject, beta. All 19 subjects are important. Do remember that. Okay. Now, when I talk about the first revision, we have given more time for the first revision because we have to do the first revision line by line. Whatever has been written in your notes, beta, from wherever you have studied, from whichever platform, does not matter. So whatever definitely you have read, and all the FMG students, whatever notes have been provided to you do not have to skip your notes, bache. You just have to follow them, whatever has been taught to you. Do not go beyond that. Just try to revise the same notes. Why? Because if you revise the same notes twice or thrice, beta, a photographic memory gets developed, and that imprint which is there in your head, you will be able to recall the same photographic memory or that imprint from your head, beta, during the examination time. Okay? So even if you do not remember it exactly point by point, you will remember that picture, and that is what is more important for us. Isliye, do not definitely fall into trap. Do not go behind a lot of revision videos or a lot of revision PDFs, and especially those beta which claim something that in a span of 2 hours we are going to revise this whole subject, or within a span of 2 hours you're going to get a lot of MCQs in the examination, right? That's not possible, beta. Because if those videos or those PDFs would have helped you to solve all the questions, please remember, we would not have taught you all the things that we have been teaching, right? Otherwise, we would have just taught that specific content itself. So that's not possible. That's just a claim that a lot of people tend to make, but that will not always be true. So do not fall into those traps. That's a humble request from our side. Okay? So always continue with your revisions for both the times. Basically, in both the revisions, definitely you have to just follow your own notes itself. Do not fall into trap of a lot of videos, a lot of YouTube sessions, or even the new PDFs which are coming in the market. So that is what is advice. In the first revision, you have to make a proper plan and go line by line. Read all your notes, keep a marker or highlighter in your hand, and keep on highlighting the important points. Why? So that you're planning out for your second or third revision. Because in second or third revision, you will not get enough time basically to read line by line. So at least you will can see the highlighted points. Okay? So that is what I've told you already. As I've told you with an example, I'll just give you a brief idea that in the first revision, when you highlight the points for second or third revision, make sure, let's talk about the topic like achresia cardia, which is a sarkari topic we know. So just highlight the important points. Like definitely we know loss of ganglionic cells from which plexus? Mesenteric or Bach's plexus. Next, deficiency of nitric oxide and VIP. Third, manometry. Fourth, Birdbeak appearance. And fifth, Heller's anatomy. That's it. So if you highlight these kind of points, beta, it will be easier for you to revise the subject easily within a span of 1 or 2 days, even a huge or a vast subject like surgery or medicine. Clear? So that is what is my advice. So the first revision, as I've told you, it should be a thorough one, proper line-to-line revision. The second revision can be an ultra-rapid one, where you can just go through the highlighted or the important points. Yes, wherever at whichever topics definitely you're having more difficulty, you can take some time basically for those topics. Okay? But do not invest too much time and try to stick to your schedule as much as possible. Second important point is, now henceforth in the revision time, daily basis where you have to solve 100 MCQs. And when I say 100 MCQs, beta, please make sure that you are going to give priority to your previous year questions. Again, when I claim previous year questions, we are not only saying that only study the previous year question. And when I say PYQs, you only tend to read that question, you tend to remember or memorize that answer. But please remember, the exact question with the exact same options is not going to appear in the examination. When we say PYQs, that means we have to solve that PYQ properly and read the explanation of that PYQ so that you're thorough with that previous year topic particularly. Clear? Because the same topic may reappear in the examination. We're not sure about the same question exactly. Clear? So that is what I would recommend. If you're done with your PYQs, then definitely you can solve a lot of other questions from the QBank or the custom module part as well. No issues with that. But priority to your previous year questions and previous year topics to be given. First thing. Second important, whenever we say 100 MCQs on a daily basis, do not count your Telegram MCQs in this. Your Telegram MCQs from whichever group you solve, beta, please remember those are an add-on question. Like when you're having tea, when you're going for a stroll, okay, at that time, whatever questions you solve are from the Telegram ones. These 100 MCQs, when I say, you can divide it in a span of 50 MCQs each, and then definitely in 2 sessions, you can solve these 100 MCQs. But these are the ones which are solved from the reliable platforms with proper explanations, beta. Okay, these are not the ones that you just solve and move ahead. No. And second thing to be remembered, yes, for those topics where you are extremely sure about the answer, you may not read the explanation, that's fine. But for those topics where you have marked the question wrong or where you have marked the answer wrong and you're not very sure about the topic, or those questions where you have got the answer right, but it was just by a wild guess like a tukka, then also go through the explanation properly. Now, it's not necessary at this point of time to write down each and every explanation. That will be time taking and you will not have enough time left basically for the revision then, because the whole day will be consumed by MCQs only. Second thing, I would always ask you to solve the MCQs mainly during the exam hours, that is from 9 to 11:30 and 2 to 4:30. Okay, 2 sessions now. I'm not saying that throughout that time you have to solve MCQs, but 2 sessions, though time mein kar lena, 50 MCQs in morning half and 50 MCQs in the afternoon half, so that your mind is trained in the same manner, that you're solving the MCQs every time at like every day beta on the same time. So definitely your mind gets trained very well for that purpose. That is what is important. Okay. So this is important, beta. Do not again go in solving almost 200 or 300 MCQs on a daily basis. That's just a waste of time. Please remember, then you will not have enough time left for revisions. And if revisions are not done, beta, you will never improve on your mistakes. Because whatever mistakes you are doing in your MCQs, you have to analyze those. You have to analyze why the mistakes have happened. And then you have to work on those mistakes definitely. Okay, otherwise definitely you will never improve with your strike rate, and then you'll always be nervous that why I'm working so hard but still I'm not getting any improvement in my strike rate or in my score. That is because you're not working on the solutions, you're just solving a lot of questions. So 100 MCQs to 150 MCQs max on a daily basis, beta, not beyond that. Okay, now over to you, Dr. Talib, to throw some more light on the revision strategy that we have planned.
Hello, everyone. Now let's discuss the very important strategy topic for this session. That's going to be grand test. Now, the first question, so when to attempt the grand test? Second question, how to attempt the grand test? And the third question, sir, after the grand test, how to analyze this grand test? Now, my dear students, the first thing I would like to mention is that all of you have been through once, like all of you have at least completed one revision of all 19 subjects because the exams were delayed. Okay, so when to attempt, if we talk about the strategy of first 60 days, so first to 15 days, first GT should be on the 15th day, then to the 30th, then to the 45th, and then the last GT. Now, few things I would like to mention before attempting a GT. Just take it as your real exam. Number first thing. Number second thing is try to be patient. It's not like, okay, if you know the answers very fast, what you guys do, when you try to solve the first part of GT, part A, you go through 30 questions, 40 questions, then you become eventually tired or exhausted. And what do you guys do? You try to mark randomly answers. And at the end, you're like, sir, we will see the answers and explanation at the end. But that's not the real GT. The real grand test is, if it's 150 questions, you exactly have to give 150 minutes. Okay. Number first thing. Number second thing is, after giving a grand test, take a proper break of at least 1-2 hours, go for the part B. Just like the same in your real exams, so that you will be mentally prepared as well. Because sitting is the most important part as well. Because most of the students, I already mentioned, that you leave behind after 50, 60 questions. Either you skip the GT because you might go through some hard questions. Next, either you will be tired or you keep it on a pause. Okay, so first thing, so 150 questions, exactly 150 minutes. Second, do not try to change your answers, because if you will try to be patient right now, if you control yourself right now in the grand test, do not change your answers. Okay, now after the GT, once you have gone through a GT, how to analyze a GT? Okay, now basically the grand test is of 300 questions. These are exactly 300 topics over there. Okay, don't take your grand test lightly. This grand test will reveal a lot of things. It will reveal your weaker subjects. It will reveal your strong subjects. It will reveal your concepts and where exactly you lie. Okay. Now, when you review these GTs, the first thing, if you have a more focus on which part, more focus should be on the conceptual part. More focus should be on the questions that you have marked wrong. Okay. Now, when we talk about the questions that we have marked wrong, so what are the questions? So the question can be wrong of 3 reasons. So either I don't know the concept. So either it was my random guess. So either I was basically confused about 2 options, option A or B. So when you review your GT, there should be 3 things on your mind when you check your wrong answers. First thing, so is my concept clear? Second thing, so I was confused about option A and option B. That means your revisions were not enough strong, so that you were only able to rule out two options. Okay, either, sir, it was a fully random guess. So after you review your GTs, okay, divide it into three parts. As I've already told in your classes, 100 questions, 100 questions, and 100 questions. Okay, so give basically a one full day for a GT review. In the morning, you go through 100 questions and do read the explanation of every single question. Even if you know the answer of that particular question, still go through the explanation part and mainly focus on the GTs. Mainly focus, there are multiple platforms over there. Yes, you can give your grand test from any platform, whatever your wishes, but please, the explanation part of the grand test should be very, very, very concise and conceptual. Okay, if they have mentioned particularly, they have mentioned any topic, they have only explained that part. Rather choose a grand test in which a full topic has been explained, so that at least that particular question will be from that zone only. Okay, now, so most of the students are like, so we are scared to give a grand test. So what if the things will be wrong? What if the score will be very less? What to do? My dear students, at least when you are planning your first GT, for example, you gave your GT after 15 days, your score is somehow 150, 135. No need to worry. Analyze your mistakes and make a second goal that in the second grand test, I have to score at least more than the score that I have in the previous GT. For example, if your score was before 135, now your goal is at least I have to score more than that. Second GT, 155. Third GT, 165. Fourth GT, you will reach up to 180, 185. Now, the thing is that when you go and review these all four grand tests, you will see there are most of the questions that are repeated. If not questions, there are the topics that are repeated. So basically, when you are reviewing a first GT, in the second GT, there will be 100 MCQs that will be from the same topics. And the explanation of those 100 topics will be same. So you are saving time. And in the third GT, there will be mix up. So in the beginning, if it takes 1 day, 2 days to review the full grand test, the second grand test you will review just in 1 day. Third grand test, a half day. Fourth grand test, you will just have a 3-4 hours. Basically, it's about 1,200 questions, the 4 grand tests that you are giving. And in these 1,200 questions, there will be only max to max 450 topics that will be repeated. Because we'll not have all 1,200 topics. If a question is based upon a pheochromocytoma, they will ask investigation of choice. In the second GT, they will ask the treatment. In the third GT, they will ask the diagnosis. In the fourth GT, they will ask the drug, pre-operative, intraoperative, or post-operative. Basically, the topic is same. So please review your GTs with a full detailed explanation and focus on the wrong questions. Okay, that's how you have to attempt the 4 grand tests within the span of 60 days. Now, the second part of this strategy is one-liners you have to go through. Now, if we talk about the one-liners, there are 2 ways. Either you directly go through a last-minute revision book, as we have in our AFMG channel as well. You can join the Telegram channel. In the file section, you will find the one-liners LMR. Okay. And next part of reviewing these one-liners. So all the wrong questions, as Dr. Omkar has already said, you solve daily 100 MCQs conceptual. जो आप ये 100 questions रोज के कर रहे हो, all these 100 questions, it should be not including the Telegram questions. Telegram questions are the add-on. Telegram questions are same like your Instagram reels. When you are bored, when you are scrolling the reels, the same criteria should happen to these Telegram MCQs. Okay. Now, when you are solving these 100 MCQs, for example, 20 questions are wrong. I will take the example from my subject. You are solving a question from the ectopic pregnancy, very important topic. Now, a clinical case is given that patient is having a ruptured ectopic pregnancy with the blood pressure of 80/40. Patient is in the shock. What will be the management? Now, patient is shocked. The management is going to be laparotomy, self-injectomy, because laparoscopy will be contraindicated. So try to make this particular question, if you marked it wrong, try to make this particular question into a one line. So you will write ectopic pregnancy / ruptured ectopic pregnancy / laparotomy management. So basically, you're making a full clinical case into a one-liner. And every day, all the 20 questions, all the 30 questions you are marking wrong, please note down them in your mistake notebook. You have to make your own one-liner book. And in these 60 days, every day 30 MCQs are wrong. So every day 30 one-liners have been edited in your mistake notebook. And this mistake notebook, every day you will read morning for 30 minutes. Do not take the screenshots of your wrong questions because, as Dr. Omkar said, we have been through the same process. We have been like you guys only. So whatever we have followed during our time, we are basically telling you exact same thing to follow on. There is not an experimental video for you guys. It's not like we are saying something and you're going for the experiment. No, whatever we have followed and whatever is possible in these 60 days, that's what you guys are doing. Okay. So write down all the one-liners, write down all your wrong questions in your mistake notebook. Every day you will read and review these 30 MCQs, these 30 one-liners. So for the next 60 days, first day is 30 one-liners, next day 60. So it will keep adding on subject-wise. And this mistake notebook is your deficiency notebook. This is not my deficiency. This is not our deficiency. This is not anyone's deficiency. It's exactly your mistake notebook. So basically, after you go through these one-liners, all the right questions you already know, but at least these wrong answers, all the wrong questions that you have attempted in these 50, 60 days, that will be in your mistake notebook. The third part is going to be snaps. As we have already proposed the full file of the snapshots in the AFMG Telegram group. Okay, that's all 19 subject snaps. They are not only the snaps, but along with the snaps, Dr. Omkar has already mentioned some detailed information about those snaps. So it's not only a particular picture. For example, if you have a picture of a sandfly or a phlebotomous fly, it's written in down there, okay, it causes leishmaniasis. It's a vector for leishmaniasis. Down there, there'll be also a drug of choice written, amphotericin B. So basically, if you're going through a snaps, you're also reviewing the important questions. You're also having some extra informations. So go through AFMG Telegram channel, go for the file section. Okay, check there is snaps, 3 parts of the snaps, all 19 subjects. Now, how to approach these snaps? At night, 30 minutes every day, but not randomly. For example, if you're going right now through the PSM, or if you're going through microbiology or pathology, open the snaps pathology section and go through the pathological image in these 60 days, every day, 30 minutes, subject wise. So that should be your pattern for grand test, one-liners, and the snaps. Okay. Now, how exactly you should plan your first revision? Over to Dr. Omkar, he will discuss.
Thank you, Dr. Talib. Now, important is, Bacho, the first thing Dr. Talib has given you a detailed idea about how definitely you have to attempt all your grand tests, then include one-liners and the snaps in your strategy. One important thing I would like people to know that even if you're not scoring good in your first grand test, just be persistent enough. Just learn from your mistakes that you have done, basically. Okay, do not be afraid of the grand test, because it's not always that the grand test marks are going to appear in the examination. Okay, so please be sure that even if you're scoring less in the grand test, just be persistent at it and learn from those mistakes that you have done in your grand test. That should be your idea, beta. Grand tests are for the purpose of learning. Okay, so let's dive into the plan for your first revision, beta. How the plan for your first revision should be. So as I've told you, the first revision should be comprehensive and conceptual enough. That means you are going to read line by line, definitely, whatever has been written in your notes. And secondly, when you're reading those lines, when you're reading that topic, you're trying to recall how the faculty has explained that particular topic in your classes, how we have discussed that topic in your class. Okay, you may be able to recall or remember even the jokes that we might have cracked, basically, or the analogies that we might have given beta while explaining that particular topic. So while definitely you're doing your first revision, one method can be read line by line, and secondly, try to recall how this concept was taught in your class. Or second idea can be just try to read and remember definitely as if somebody is sitting in front of you. Okay, just imagine that somebody is sitting in front of you and you are telling that person, definitely you are teaching that person by reading that topic. Basically, you're explaining that next person. Why? Because explaining that particular topic will definitely help you, Biche, to remember it and to understand it much better. Okay, just look into a mirror, explain it to yourself. Doesn't matter. Nobody is going to judge you over there. Clear? So that is what is important. This is how your first revision should be. And the second thing that I've already told, that always have a pencil, marker, or highlighter in your hand while you're revising. If you're not doing that, basically your notes are just in front of your face, beta, and half of your mind definitely will be on Instagram, on YouTube, definitely on your relationships or somewhere else. Clear? So make sure that those revisions that you're planning, definitely, they are a proper revision where you're focused, okay? And you are definitely scribbling through your notes, definitely, while you are revising things. Okay, understood? So now when we plan for first revision, all the major subjects, like the 4 major subjects, medicine, surgery, obstetrics and gynecology, and PSM, that is community medicine. All these 4 major subjects, beta, should be given 3 days each. So that will be a total of 12 days. Next, after that, the moderate subjects, beta. When I say moderate subjects, that will be the clinical moderates, that is ENT, ophthalmology, and pediatrics. Along with that, the pre and paraclinical subjects like pathology, pharmacology, microbiology, anatomy, biochemistry, and physiology, beta. All these subjects are moderate ones. So you should give around 2 days, beta, each for each and every subject. Okay? So definitely these subjects are going to be revised 2 days each, beta. Next important, let's talk about the minor subjects. When I talk about minor subjects, that is dermatology, forensic medicine and toxicology, anesthesia, orthopedics, radiology, which all these minor subjects which are there, beta, they should be given 1 day each. So when you do a total, basically, you will get a 36 days of revision plan for your first revision. Here we have given definitely 3 days for all the major subjects, 2 days for moderate subjects, and 1 day for a minor subject. Reason is, in this revision, you should go through each and every part of your notes, beta. You're not going to skip anything. Second important thing, you should try to understand and recall the concepts so that you are refreshing your memory, you are rejuvenating your memory, beta. Okay, whatever has been taught to you in the classroom. You're not just reading it, okay? Otherwise, it will be so dry revision. First, you will get bored. Second, you will not remember the concept only. You will try to memorize it. And please remember, do not invest too much amount of time only in the one revision. Otherwise, what I've seen a lot of people doing a mistake, that they think that, no, I will do medicine revision for 7 days, but I'll try to remember everything in one go. That's not practically possible, bache. Please remember that. Okay, give due time to each and every subject, because each and every subject is important, as I've already highlighted. Second important thing, even if you give 7 days for medicine revision, beta, you will find that after 5 days or after 7 days, you have forgotten most of the things. Because what is more important is not one detailed revision, rather more number of revisions. You have to focus on more number of revisions, beta, because more number of times you revisit that topic, the better you are going to remember and recall the things basically in the examination. Clear? So that is what you have to do for your first revision, beta. In this itself, now whenever you have solved the whenever you have revised the content of medicine, beta, like for example, you can plan for the next day. For example, you do not try to like go blindly. Just try, okay, next day I'm going to do these 3 to 4 systems of medicine for my revision. Now again, do not plan your cardio and neuro on the first day itself. Otherwise, you will get so anxious that you are not able to remember anything from the class. Okay? So always combine a difficult system with an easier system, beta. So that is how your hopes will be high. Otherwise, you'll lose the hopes, basically. Okay? So that is what is important. So please remember, you can combine your cardiology, which is a difficult system, along with the other easier systems like rheumatology, or for that matter, nephrology, beta. So this way, it will be much easier for you. Okay? So one thing is that. Second important thing, definitely, beta, once you have revised all the content throughout the day, definitely you can solve your MCQs. Especially try to solve the MCQs in examination hours. But if you're not able to, then you can solve the MCQs in the evening hours. Now, when you are solving your MCQs, make sure when you make a custom module, basically, then do not add up all the 19 subjects, because I've seen a lot of students adding all the 19 subjects in one custom module of 50 questions. What is going to happen? Do you even think that it will include majorly the questions of the major subjects or maximum the moderate subjects? Minor subjects will be completely ignored, beta. Maybe a test is only having 5 questions of ENT and no question of ophthalm, right? That is what is going to happen. So do not add too many too many subjects, beta, while framing one custom module. Maximum 2 to 3 subjects. The one subject that you are revising right now and one subject that you have already revised earlier. These are the 2 subjects I would recommend you to add. Okay, otherwise you will not be able to solve enough number of questions from each and every subject. That is what is my advice, basically, that you have to keep in mind, bache. Okay, so that should be your plan. Second important, you can obviously do some modifications in this plan that we have provided. In case, for example, if you're getting bored with one subject, you think, okay, so before starting your revision itself, while you are framing the schedule itself, you can do one modification in the schedule. And that is what, for example, you know that remembering all the drugs of pharmacology becomes very difficult on one day itself. So this 2 days of pharmacology, you can divide it, you can fragment it. How? You can revise pharma in 4 days, basically in the morning hours. So morning hours you can keep for pharmacology. Like for example, you have revised general pharmacology and ANS on one day. You have revised half of the systemic pharmacology, majority of the systemic pharmacology on second day, half of the systemic pharmacology on the third day, and then fourth day you can revise your antibiotics, anesthetics, miscellaneous group of drugs. Clear? So that is how you can fragment your revision. Same goes for your microbiology or anatomy or even biochemistry like subjects. Why? Because here you may have to remember a lot of new drugs, new enzymes, new bacteria, their names. It becomes very difficult for some students basically to remember all of that in one go itself. So you can fragment down these memorizing or the factual subjects or the volatile subjects. Okay? Then what you have to do in the evening half then? In the evening half of that day, you have to revise another easier subject. Like for example, definitely we have given 2 days for ENT. You can just fragment that 2 days into 4 days again. So when you're revising morning half mein pharmacology, revise evening half mein ENT. Right? One day you can do larynx, second day you can do pharynx, third day you can do nose and paranasal sinuses, fourth day you can do ear. This is just a brief idea I'm giving. Obviously, you have to do divide here, but still, this will be a brief idea, beta. Hopefully, you have understood. So even if you have to do a modification, that also I've thrown some light how you have to do that divisions basically and create a or recreate a plan for yourself. Okay. So this was my from my side for the first revision. Now I'll come to Dr. Taleb and want him to throw some light on the second revision plan. Okay. Over to you, Dr. Taleb.
Thank you, Dr. Omkar. Now, my dear students, let's talk about the plan for the second revision. Okay. Now, you all know that the revision first should be detailed revision. Okay. And you have to go through all 19 subjects. And now, if we talk about the second revision, so it should be faster, right? As the first revision, you had 36 days. Now, the second revision, you have to complete 20 to 23 days. Okay. And what exactly to focus on? Now, you will ask me, most of students ask me, sir, why to focus? But my dear students, the answer knows only one person, that's you. How? Now, basically, all these previous 40 days, when you are solving all the MCQs, all the recall questions, all the previous year questions, all the previous year's topics, those are your high yielding topics. Okay. So while going through your recall questions or while going through your previous year questions, make sure you take your notes in front of you and mark that this question is important. So if you talk about our subjects, most of the faculties, all the faculties, when they go for the main classes, we usually mention that this question has been asked in previous year. This question has been asked in NEET PG exam. This question has been asked in 2022 FMG exams. So what are your high yield topics? These are all the high yield topics. Now, your main focus in the second revision should be your high yielding topics. Number first thing, your image-based questions, your recent pattern that has been changed recently. They have been asking some typical questions. Those should be your main focus in the second revision. That's why while going for the PYQs, please keep a one highlighter. For instance, you take a pink color. Keep this pink color just for the high yield topics. Do not paint all your notes. Okay. During my time, I used to paint all my notes. Don't do that. Okay. Don't paint all of your notes with highlighter. Okay. Only highlight the very important stuff, very high yielding stuff, and the topic that you are usually weak. For example, if there are some questions coming from a main topic and that is a very high yielding topic, focus on that particular topic more. That should be your second revision. So medicine is going to be 2 days. So divide your time accordingly. Don't put volatile topics on the same day. If medicine is 2 days, mix it with easier topics as well, volatile topics as well. OBG, 1 day for obstetrics, 1 day for gynecology. So same you should follow for the next 23 days. That's how your second revision should be planned. But more focus on your high yielding content, more focus on the mistakes you have done in your grand test. Now, as I've already discussed, the grand test, all the mistakes, all the wrong answers, you have to analyze. And then by side, whenever you review your GT, your note should be by your side. Please, my dear students, don't go for the substitutes. We'll have a quick revision session, right? We'll have all the rapid revision sessions, but do not skip your main notes. Main notes are the primary notes. Is that clear? So main notes will open. You'll open that particular question. You'll open the topic from your main notes and then exactly analyze where is the mistake have been written. Okay, in case you have any doubts, you always reach to us. So same time, take a picture of a note, take a picture of the question and reach us, so that we can simplify the answer. Okay, now after the plan for the second revision, just turn up the slide, Dr. Omkar. Now after you go for the second revision, as I've already discussed, MCQ and the grant test analysis and review. Go for MCQs, 100 questions a day. Write down your wrong answers, wrong questions in a one-liners in your mistake notebook. Give 4 GTs, and how exactly to review them. I've already mentioned that. Check either you don't know the concept, either you're not able to recall, or either you're confused between two options. Go through that particular topic and make sure that the fourth grant test, the third and fourth grant test should be at least much better than the previous two. If your first grant test score was 135, the last grant test score should be between 180 to 195. Sometimes the grant test that you attempt is hard, is out of your reach. Some grant tests are very hard. They're not even the FMG exam level. Do not get confused. Okay, do not get stressed. So how to know whether the grant test is more hard or whether the grant test is easy? Now, being a faculty, I cannot go through all the grant tests and tell you whether the level of the grant test is hard or the level of grant test is easy. But my dear students, you can know by yourself, by going through PYQs, by going through recall questions and comparing the questions that you have gone through. So you will exactly know. Basically, it will be easier for a repeater, because the repeater knows how exactly the question comes. Repeater knows where to focus. But if you're someone who is a fresher, go through the PYQs, okay, and then compare the topics and the way of asking the question. You will get to know by yourself whether the level of this exam is hard or whether the level is moderate. Okay, now next part is going to be the analyze weaker subjects. Now, sir, how to analyze your weaker subjects? That basically you are getting from a grant test only, because grant test will let you know which subject is your weaker subject. So which subject can be the weaker subject? The subject you are not interested in. The subject you might feel very difficult. The subject it's hard to understand. Eventually, when you don't have an interest in a particular subject, after some time, it will be what? Your weaker subject. Now, most of the students, those who are weak in anatomy, in physio, most of the FMGs are weak in anat, because we feel it's very dry. Now, how to approach these weaker subjects? How to make these subjects stronger? Now, most of the students will say, sir, I'm skipping this time anat. Sir, I'm skipping this time this particular subject. My dear students, do not skip a single subject, no matter what. You don't have to skip it at all. Okay, go and ask someone who scored between 140 and 149. Ask them if they skipped a one particular subject, how much it cost them. Now, how to approach to a particular subject that you're weaker? First thing, try to go through a first reading. After that, try to solve the questions. Even after reading thoroughly, even after reading actively detail, you are not able to solve the questions, right? Because concepts are not being understood. Now, what to do, sir? Should I have to skip the subject? No. Open the PYQ section of your app. Solve all the previous 3 to 4 year questions of that particular subject along with NEET PG recall. But it's not the MCQs only you attempt. As we already said, it's a previous year topic you have to focus on. At least go through all the previous year questions and previous year topic of that particular subject. Even if 10 questions, 15 questions will come from that particular subject, at least if you have gone through previous year questions and previous year topics, will be able to solve 50 to 55% of those questions. So it's better to go through a PYQ and PYTs rather than skip a subject. Okay, now further, why the MCQs have gone wrong, Dr. Omkar will discuss, and it's all from my side. And even after you finish this video, even after you have any doubts, you have any queries, anything, because sometimes the schedule that we made or sometimes the approach of a student towards a particular strategy is different. So if you have any query, any doubts, any question regarding to this session, please reach out to us. We are always there to help you unless and until you cross this finish line. Over to Dr. Omkar.
Thank you so much, Dr. Talib. Now, the final part of this video, beta, and that is find why the MCQs have gone wrong basically. So whether you are appearing for the normal custom modules or you are attempting a grant test does not matter. Whichever MCQs you have solved, how to find out basically why those MCQs have gone wrong, and secondly, how to find out the problem specific solutions for them. The first thing is, I always say, maybe you have read that particular topic, you have understood that particular topic, you're able to recall that particular topic also while solving the MCQ. The problem was basically, as you were not able to actively recall it, or maybe beta, as it was taking a lot of time to understand the language of that particular question, or maybe you're just exhausted. Okay, so what happened, you just marked whatever came to your mind first basically, okay, and you moved on. So obviously due to that the question has gone wrong, and this will be obviously considered a silly mistake because you knew everything about that topic, still you have marked that question wrong. So please remember, why you're doing a lot of silly mistakes, okay, in the MCQs or in the grant test beta, always analyze that. Why the mistakes have happened? Were you not focused? Definitely. Were you in a hurry to solve those questions? Definitely. Or the like you were not interested in appearing for that grant test the same day, whatever was the reason. Please make sure you're not going to repeat the same mistake again, so that you can minimize all your silly mistakes during the examination. If you have got anxious during the examination beta while solving MCQs, then I always say take a break, close your eyes, focus on your breaths, take deeper breaths beta for 10 to 15 seconds, and then again read the question. You'll surely get the answer for that. Clear? One thing. Second important, a lot of people get blocked while solving the MCQs itself. Like they're not able to understand, and then everything goes wrong beta beyond that point. So at this time, basically, when you get blocked, then just move on to the next question. Whatever comes to your mind beta, mark the answer for that particular question, mark that question for review, and move on to the next question. Do not waste a lot of time in one question, because if you waste 5 minutes or 10 minutes in one question, you will have lesser time left for the upcoming ones. That is one thing that will give you more anxiety, and that will definitely increase the rate of silly mistakes in your examination as well. Okay, because you have lesser time. So even if you are very good with that topic, you did not have enough time to recall, or due to that, definitely you read the question half and mark the answer. And that will definitely increase the probability of marking that question wrong or doing silly mistakes in the examination. Okay, so to avoid that, do not be in a hurry. Read that question properly, pick up the keywords of that question properly, come to a provisional diagnosis, go through all the options, rule out the options one by one, and then you will ultimately come to the final answer beta. That is what is important. Okay, so always be calm, composed, and patient while appearing for a custom module or a grant test. Does not matter. That helps in minimizing silly mistakes. One thing. Second important is, maybe the question has gone wrong beta because you're not able to understand that topic, you're not able to comprehend that topic basically during your classes. So try to go back to that topic once again, try to break down that topic, try to understand it easily, and we are always there basically. Okay, we have always told you that wherever you are having any difficulty in subject, reach out to us. We will try to definitely get back to you either with a text message or a voice note, and we will try to simplify that topic, or at least tell you the important points to be remembered for that particular topic. Okay, so that can be done. Second important, you can go through the explanation of that particular topic beta, and in that you can definitely summarize that explanation. You can try to write it down basically, okay, either in your notebook or on a sticky note, so that you remember, okay, these are the important crux or the important points about this topic, and I should not forget this because I have been repeating the same mistake time and over again, and I have a lot of difficulty with this particular topic. So this can be done better to simplify that topic. One thing. Second important, maybe you have understood that topic in the class beta, but now you are not able to understand this particular question because the language of asking that particular question was very tricky and very difficult. So try to break down that question. Always try to convert the language of that question in your own mother tongue, so that things become very easy and you are able to understand that what are they actually wanting to ask. Okay, so when you convert that or translate the same lines beta in your own mother tongue, things will get much simpler. Okay, because I know a lot of students do have difficulties in English. Okay, and that's acceptable, no issues with that. But just try to work hard on that. Every time you go through the MCQ beta, and that MCQ you have marked wrong just because you're not able to understand the language. Try to break down that language, okay, and try to understand that language basically. So it becomes easier. Every time you'll come up with new language also, it will not be difficulty for you. Second important problem will be you are able to understand that whole topic. You are even able to understand that question beta. But the problem was basically you're not able to recall on time. You did not remember basically. That was because you were having lack of revisions. You may have to go for one more revision, bache, so that definitely once you revisit your notes again, you will be able to recall that topic much better. Okay? So that would be done basically beta. And if you're not having enough time to go through that all subject all over again, because you have already revised it twice and still you are marking that subject wrong. So even if you're not having enough time to revisit that whole subject, at least go through the important topics or the topics you are marking wrong again and again. At least make sure that you are going through those topics from your own notes. That is what is done. Third important point will be here you were even able to recall the particular topic beta. Everything you were able to recall from the notes basically. Okay, that picture got imprinted in your head. But the problem was you're not able to approach the MCQ. This is what I have taught you in test and discussions, bache. That is what we have to analyze. We have to definitely pick up the keywords. Again, keywords are what? Keywords are the most specific and the most characteristic symptom of that particular disease. Now we know that definitely beta, a lot of diseases will have similar symptoms, but there will be some 2 or 3 specific symptoms beta which will differentiate a particular disease, and that is what you have to pick up. For example, let's talk about a condition like multiple myeloma. We know that multiple myeloma may have very similar symptoms like anemia, renal failure. These could be similar symptoms beta which can be seen in other conditions also, but multiple punched out lytic lesions will be a keyword for a multiple myeloma case. Elderly patient coming to you with low back ache will be a keyword for a multiple myeloma case, right? So definitely these are the keywords that you have to always pick up beta. The age may be, the sex may be, most characteristic or the most specific symptoms of that particular condition. These are the keywords that you have to pick up always. That is what I've told you. Why? Because if you try to pick up a keyword, even a 5 or a 6 liner questions can become 2 liner question beta, and you can easily come to a provisional diagnosis. Provisional diagnosis means the diagnosis that comes to your mind beta after reading that question first. Okay? So even if 2 or 3 diagnosis comes to your mind, that's fine basically. Okay, no issues with that, but still you will go to the answer. Okay, so that is what is important beta. Make a provisional diagnosis. That should be the second step. Third important step, use the image basically, okay, to make it more simpler. And fourth important thing is definitely try to rule out the options one by one. Even if you do not know the exact answer for that question, still you will be able to mark that question right beta if you rule out the options. Okay, there will be one option which will be completely irrelevant or unrelated to that topic. You have to rule that out first. Next would be a option beta which is from the similar subject, maybe from the similar topic or nearby topic. You can easily rule out that also. Now you're left with the last 2 options which are very close to each other. I have seen a lot of students asking me one doubt that, sir, we are always confused between 2 options and we tend to always mark the wrong option. So make sure that definitely beta, this happens because both those topics are very similar to each other. So write those 2 topics on a sticky note beta in a tabular format, and do not write the similar symptoms. There may be 10 similar symptoms in both those topics. Just write the 3 major differences. What are the 3 important symptoms which will differentiate both these diseases beta? Okay, once you definitely go through that table, those three important points about those 2 diseases, it will be very easy for you to differentiate the 2 topics basically beta, or the 2 options, whenever it comes in your examination or whenever it comes in your granters the next time. Clear? So that is how you have to approach your MCQs, which, and that is how you have to solve. And always, whenever you are attempting MCQs or grant tests, whenever you are analyzing your weaker subject, make sure that you are writing down why this particular subject was weak. There were 3 to 5 subjects which were in the weaker range beta, maybe anat, physio, for example, surgery, obs gynae, and for example, medicine beta. Now you have to analyze why these subjects were weak, why they were not strong. Now, maybe there is not a same reason which will be applicable for each one of them. Maybe anat was weak because your recall was not strong beta. Therefore, you have to give one more revision for anatomy, right? Medicine and surgery were weak because you're not able to understand and comprehend this topic quite well. So go through the notes again and try to understand and comprehend those topics at least properly. Okay? Maybe obs gynae was weak because you know that very well, but the problem was you did not solve enough number of MCQs from obs and gynae. So do that. If you do this subject specific, if you find these subject specific or problem specific solutions, beta, I will surely tell you that you will improve in the next grand test. And in the next grand test, out of those 5 subjects, at least target that 3 subjects should not be in that weaker range. Okay, at least try to make them average. I'm not asking you to make them stronger. Okay, so that should be your approach. Any difficulty, any issue you are going to face in this preparation strategy, beta, or during the revision, we are always there for you. And as we always say in FMG, that the hand that we hold from the start of your preparations, we are not going to leave that hand till the day of your examination, beta. Do not definitely worry about anything. Okay, even if you are facing any kind of issues, you can reach out to us either on our WhatsApp or on Telegram. Wherever you reach out, we'll always be getting back to you and will be answerable. We are not those that who will say that okay, reach out to us and we may not answer. Okay, we'll always try to take our time for you. Okay, so do not worry about all of that. Okay, chalo, so take care. Make sure that you are going to make this preparation journey worth it. Okay, all your efforts are going to pay off. Okay, all of you have that capability in yourself that you can go through the examination and you can come out with flying colors with it. Clear? So just keep your thinking positive, and obviously it will turn out into positive results. And when definitely the positive results come out, everyone around you is going to be happy. We know, I've always told you one thing, that always work hard for those 2 smiles which you are going to witness on the result day. That's the most important and the worthy thing that you can ever achieve in life. So just try for that day, Viche. We're always there with you. Thank you so much. Take care and all the best.